or some input and ideas on where we could potentially head based on what they have heard tonight, and hear that in their own words. So first, I'll invite Genevieve back up to grab a seat if she would like. I would also like to invite Ash Marwaha up to the stage. He is an early career clinician scientist and clinical medical geneticist focusing on complex immune dysregulation disorders. He has had a collaborative approach to build an integrated research care pathway that aims to diagnose the cause of rare diseases and lead to improved targeted treatment. His research expertise includes whole genome sequencing, RNA sequencing, polygenic, risk score analysis, epigenomics, and machine learning integration of multi-omic data. He ultimately wants to use his extensive clinical trial experience to implement precision therapy for this patient population. You got your microphone, perfect. And I will also invite Ian Stedman up. He's an associate professor in the School of Public Policy and Administration at York University, and is also CRDN's Care, Support, and Empowerment Pillar Lead. Diagnosed with Muckle-Wells syndrome in 2012, Ian is a rare disease patient, parent, and advocate, having formerly served as a board member of the Canadian Organization for Rare Disease. Ian now serves as the board chair for the Canadian Auto-Inflammatory Network and also as a legal member of the Research Ethics Board at Sick Kids Hospital in Toronto. You need a microphone.
I could yell online, I guess.
This is not my show. So I will just open the floor to any of you who have something to say or reflect upon.
The problem is I could talk all day. So if you have something you want to get,
I've been on panels with both of you, and you both always have much better things to say. So I think you should go first, Ian.
Okay, I'll get us started. So I came in a little bit late, so I didn't see the first little bit. Flew in from Toronto today, which apparently we've already won the election. It's already over. They just called it for the Liberals. As we all sit here, people are still voting in this part of the country.
You did miss the first part because there's a conversation about it not being political tonight.
Sometimes you got to turn on the phone.
Yeah, exactly.
I think for me, I was diagnosed 12 years ago. And like many of you who are in this space, I have a child who has inherited the same genetic disorder that I have. And I've spent 32 years, right, feeling alone, feeling like the system didn't see me, feeling like, I mean, I'm suffering through all this, what's going on? And I spent the last 12 years really learning that there's a massive community of people going through similar situations, similar experiences. And then this research community that I don't have a background in science and medicine, but as I've come into the rare disease space, I've just met some incredible people who are all doing it for the right reason. And for me, I think that's heartening when we think about what we're doing here today and with the CORD conference over the next couple of days. We get to talk a lot about the what, like what's happening, who's doing what, but also about what's not happening and what's not working. And that's real and that's personal. And then we get a little bit intellectual and we step back and we say, like, why? Why are things not working? We hear about access to therapeutics. I sat in my board, the Canadian Auto-Inflammatory Network, and we had a meeting with some of our patients this week. And we're like, well, what are we going to do? How are we going to get out there and advocate? And then one woman says, hey, can I just tell you that I can't get access to the medicine that I need because it's off indication. So no one will pay for it. And so I still don't have access to it. And it just recenters you. It just reminds you that like there's a lot of exciting stuff happening and there's a lot of positives and a lot to be excited about. But then there's still the everyday stuff that isn't working. And it really behooves us to sit in these spaces and not just celebrate, but also plan and figure out how can we mobilize what we're hearing from the patient partners to really motivate the research community. And I would add to that, and then maybe this is more a tomorrow thing, but the policy community. We talk a lot about policy, but we're not really doing a good job of getting anyone to listen and put stuff in place. I mean, not to be political, but but that's, I think, what I'm excited about. I'm a lawyer by training. I'm in the School of Public Policy now. was never going to be an academic until my diagnosis, and that kind of reshaped my career like it did for many post-diagnosis or your child's diagnosis. You kind of reshape what you think life is about. And that's what's got me into this space. And I'm like, I'm excited because we have a space where rare is actually being seen. And I think that the rare disease community is one that's, we've gone into every medical encounter and personalized it to us. You had to be the one who knew everything about yourself or your child. You have to go into every clinical encounter and tell each new doctor what you've been. So why are you here? What's going on? Here's 32 years dumped onto you. So I think the future of our healthcare system is going to be one that really is animated by what we've been learning and speaking about in this community. This is why this system doesn't work for us as zebras, but we want to build a system that only works, that treats everyone as though you're a zebra, right? So that's what really excites me, is that the life we have in this space right now. Who knows where it'll go, but I think it's all positive for me.
I sort of agree with you, Ian. I think I feel like a momentum building in the rare disease community. I don't know what it is. It may be because the Canadian Rare Disease Network has come about because of governmental funding and other things. But I do feel like people are starting to realize, just as a rare disease patient, my story is powerful, but together our stories are so powerful to enable that sort of advocacy. And I feel there's a gap in the market now with everything that's happening in the world for Canadian grown research, advocacy. Something that we're doing is something you've heard about all day, which is, this panel is an example of that, having one person who is scientific, a physician, and two people who have lived experience, right? Like someone who has both, right? Or on all sides, right? You have both. I don't have lived experience. So I feel like that's something that Canada does that other countries and research environments haven't prioritized. And so we have the opportunity to be really innovative in bringing in that patient voice into designing the studies, into the advocacy, and really getting, and there's a gap in the world for equity now. People with rare disease often face equity barriers to it, accessing care, to having their stories heard and appreciated. And in a drive for efficiency, if we're just going to concentrate on conditions that affect many people, that can make pharma lots of money because they're being marketed for treatments, then the rare disease treatments don't stand a chance in that environment, right? So I think all of those things made me agree with you, and I'll stop and then I'll let Genevieve carry on. But the other thing is, I also appreciated what you said. I think I heard amazing innovation today, like all these research projects happening. And then I thought to myself, like, I'm going to go into clinic tomorrow. I'm going to see a bunch of patients. How am I going to bring this to them for the basic things that we need to happen? And to those stories of like, that diagnosis was so important for Ashley. How could that happen earlier? How could that have been a better experience and happened even earlier? And that's challenging, and that involves implementation. And I think that's another thing that Canada maybe has. Like maybe we have people like Genome Canada, people like Genome Alberta, and Genome BC thinking about implementation of bringing these research things back into the clinic. And I think, again, just to tie it all off, having researchers work with patients really emphasizes that, because they're always then on focus of like, well, what am I doing? How is that eventually going to help someone down the road, right? So I think all of it sort of ties together. All to say, I think Canadian research probably has a lot of momentum right now, and especially in the rare disease space, and I'm kind of excited for where it's going to end up in a few years.
Yeah, and I certainly heard lots of places where there's hope, and I certainly, when I heard about Pillar 3, spending those, I've been very hopeful about that, because from my experience with my son, there was certainly a lack of attention to the day-to-day life and how one makes sense of disability supports or lack thereof with schools, or medical complexity and needing to provide nursing care to your children by yourself at home, et cetera, et cetera. So I heard today certainly hope with pillar 3, and I really believe that that's where we do need to focus our attention, because there's so few therapies that work for rare disease. Or what we heard earlier from a number of the speakers is the length of time it takes from diagnosis to treatment. And so that can take 15, 20, 30 years. And so meanwhile, we have children who need to be able to participate in everyday life, and their families and siblings who need to interact and participate. So I certainly got hope from hearing about the transition app and the transition toolkit, as my son is 17 and I feel he is going to drop off a cliff because there aren't supports or specialists who are aware of all his complexity now in the adult system. And we've had amazing support at the Children's Hospital here. And also the brain BCI, hearing again, seeing those children and they can participate and do something that we take for granted, that all children should be able to play and interact and have fun in life. So for me, I think there is so far now for there to be any change with my son and his medical outlook. So I went back to school and got my PhD because I was so frustrated with the lack of support for caregivers and the lack of understanding about the journey for children to participate in life. And so I think that's where I would like the focus to be, is recognition that we need to work with where families are at and help them as much as possible with day-to-day life.
I will take it political. I think you've hinted at it in some sense that we as Canadians tend to do more with less. It's sort of an expertise of ours. And landscape across the world is changing. And probably to a partner or someone who, especially in the rare disease space, we've always looked to the next step, because we are out of funds, out of a sense of some direction, if I'll say it that way, and we look to the States. And as things shift, how do you see that there is space for us to continue to grow in our own sort of leadership space, but also not lose ourselves? It's so easy for a researcher, clinician, anyone in the space, parents, to overextend their energy and their efforts in what they're doing, and yet still start to fill what might be a vacuum sooner than later in some space, especially in rare disease.
I mean, one way is to do it through a network approach, right? Like Canada, each site or hospital maybe doesn't see enough patients, but together, if we work collaboratively together, we do, and we can innovate. So I think that's probably what needs to happen across Canada. Is even we still have provincial barriers to certain things, and we need to think about, how do we as a nation, if someone is diagnosed anywhere in the country with a rare disease, just get them linked up to an expert, get them linked up to a community, and eventually down the road, get them linked up to either advocating for, participating in a research trial for, or receiving a therapy. So we can do that through an effective Canadian network. And there's barriers to sending someone to the States and coming back for treatment that could be eradicated in Canada. And I think we have an opportunity to do that now. And I think the government might switch the way that they think about that, because we need to be relying on Canadian homegrown things. And one of them has to be homegrown research. If we're going to be one of the sort of bastions still of free thinking and research and innovation, and research on things that other people may not realize are important because they are rare, we need to sort of lead in that space. And I think everything that's happening gives me some confidence that, the right people are getting together in the right rooms to be able to make that happen one day.
There was a comment at the very beginning of the night online about open science, the term of open science. And so that's what you're getting at here in a sense too, is what have we been doing well and what really needs to get better from that sense? Or what is the major obstacle as you see it to that, or any of you see to that? I don't want to put it all on you, Ash.
I know certainly funding is always an issue, and because, as you mentioned, there's so few people with a particular rare disease, and it's hard to attract researchers to look at that, or even to pharmacology to look at that. But I think if we try and collaborate better and work together differently and engage families, that's one way we can also look at trying changing things and hear the voice of families as much as possible, and hear what are their research priorities, what is meaningful for them. Because sometimes even with my son's case, there's assumptions about what would be helpful for families, but they're not necessarily helpful for families. So it's to actually ask what is helpful.
Is it fair? Sorry.
Well, that's good.
Is it fair to say, so I go back to my, previous self, my previous career in public relations, communications, getting a message out there and having it be loudest. Is it fair to say, sort of from, wearing multiple hats, I think you'd probably give the best perspective on this, for the academics in the room to really try and lean in further, not only to understand families and their lived experience, but to say how, like, build that relationship there. Like, that's your PR, that's your megaphone. Those parents are going to get loud and proud about their children and their experience and be the loudest call for change or improvement or shared knowledge in the community. Would that be correct? Would that be a safe space for someone in academics to turn to and really push parents for that help?
Yeah, and the family engagement in research course that you heard mentioned a few times with McMaster University is looking at that, about how do we partner effectively? So how do we partner so that it's safe for parents, and researchers also feel that it's the best environment and way for them to interact and ask questions with families too. So certainly the PACER program is also an excellent example of a way of engaging and helping families to become partners. The family engagement course is to try and help clinicians and researchers and families also all become partners. So how do we do that the most effectively? And so that families don't feel like they're just telling their stories, and then it's part of tokenism, and it doesn't feel very valued, or it's just used in a way that doesn't make the parent feel very good about it. So there's different ways of trying to get at that expertise that families have.
Ian, what gets you most excited sort of from like the policy, and what do you see on the horizon in our communities as like an agreed upon, everyone just, we can disagree on so much across our country, and yet what is sort of like a really exciting policy in your circles that you're finding, or like promise or idea that's floating out there that's going to make us innovative?
I don't know where there's one idea, but for me, the thing that stood out in the past couple of years is that we now have a space at Health Canada for rare diseases with our rare disease directorate. That's not something that we've ever had before. And that presents an opportunity for us, somewhere we can go to talk to some part of government that actually cares about this and how it fits into the whole. That gets me excited. But I think you can't think of rare disease as something different, or like a part of it's the weaved through the tapestry. Like, everything healthcare is rare disease, right? We are in every aspect of it. It's just a matter of looking at what are those unique needs for that subset of the population, and how do we tend to them within all of those spaces. So what excites me is that there's actually a space within Health Canada for this conversation now. And before, it was just beating on the door and wondering why no one's opening it.
I think the system is not set up for rare disease, right? Like medicine in general, maybe North American medicine more so than other places, even though we have a universal healthcare system, we're still rewarding like high billing specialties that, can do operations very quickly, as the most, and pediatrics is underfunded compared to adult medicine, even though they see more complex patients usually. So there's lots of things around the system that makes it very difficult to navigate. And I don't really know how you change that, but I think the sort of first step is to unite those voices and to like be loud about it. So I think rare disease has traditionally suffered from a marketing problem, maybe, and maybe we just need to think again about how we market rare disease as a community, to the powers that be to sort of advocate. And I think, to be honest, from a physician point of view, advocacy is not something that we're trained in. We're asked to do it, but we're not really I'm not sure how much it's part of our pillars of what we should be doing, but how much training did you get in actual advocacy in your medical school
figure it out as you
experience,
go along.
right? But it is a very important part of what we do. And that's acknowledged, right? Like we are meant to advocate for equitable healthcare for everyone and how they navigate the system. And I think sometimes the physician priorities don't align with patient priorities. And the way to fix that is to just take a step back and listen and not be the dominating voice in the room, and just sort of, even if it's that initial one-on-one conversation, just be the person who listens about what's happening in that person's life and trying your best to navigate it as you can. When you start listening to that, you understand that some of the healthcare outcomes that we concentrate on, like treatments to make arms longer or so on and so forth, may not be the priority for that particular patient in the room, for example.
I think before we end it, I want to make sure that there isn't like a pressing, burning question in the audience to make this a full conversation. Yeah.
Strained with my family doctors. Never mind to get a pediatrician. Never mind to see a pediatric geneticist. So even to climb to get to see the right person, and then things may be rare. Like, how do you guys connect in our country to unite and share ideas? Is it at conferences like this? Is there like, other pathways? And how do we as parents best advocate for our kids? Like, how do we find, is there research? Is there this? Is there this? How do we connect with the right people for all?
You can follow Ash on Twitter.
I think for those folks online, quickly, to summarize it really quickly, it's a matter of like, your question is, in a healthcare crisis of providers and numbers of providers who are easily accessible, and all of that being navigated through family medicine to begin with, how does a group like this in this room, parents, families, connect to that in a more strategic, fast-paced way when there's such a limit? Is that sort of a good synopsis of the question? Right. Second part, what can parents do to advocate for their child?
Yeah, I mean, the second part of the question is going to be case specific. The challenge is, if you're new to the system or learning the system, it just seems overwhelming because there's so many spaces in which we do need to advocate for change. And as a parent, you don't even see some of them until you're confronted with them, right? So, I mean, for me, what helped me was having a physician who said, "Hey, I have an idea. Do you want to speak to CTV on Rare Disease Day?" And I was like, "No, I couldn't do that." He said, no, I'll be there with you. Try it. You just say 2 things. And then the next time I said more, and the next time. So being a champion for someone, when you find your foothold in the advocacy space, turning around and saying, how can I help someone else find their foothold, right? Instead of just saying, this is all for me in this moment, taking it and trying to like expand what you're doing, which is, I think, why we're here, right? We realize that there's a purpose to why we've been dealt this hand. And the stuff about how complex it is, I mean, I'm in a social science space. So I have a law background. People in my space publish once or twice a year. And then you come into health and science and, oh my God, you are always applying for grants and always publishing, and it's constant. It is just a constant barrage of information. And I can't tell you that there's a really good way, especially in this space where we've broken down all the silos. And so you can't just be narrowly focused on a particular disease. You have to understand a whole lot. The only way to do it is really just to be online and to follow those who are in this space that you're interested in. And then some of us have egos enough that we'll post stuff that we're doing online to share with it, to mobilize the knowledge, and just following people who are in those spaces that are of interest to you. But there really is no, like, where's the website I can sign up for information that's relevant to me as a parent? It's trial by fire and just getting on there and information overload, but trying to make sense of it. And then having someone you can talk to about, does this matter? Does that matter? What's coming out? And then when you're in the conference space like this, pulling someone aside after they get off stage and saying, you said something interesting. Can you help me understand it? And I guarantee you in this space, every single one of the people who stand up on this stage will gladly sit there and talk to you for 20 minutes on the side afterwards and help you understand something that's going on that they talked about. I promise. You gonna call me on that? Someone didn't talk to you?
And I just want to add on to your thought of yes, attending events like this and calling people who are on stage and have that 15-minute conversation, because it always produces something out of it. It's just, that's a great tip.
I think one thing I just would say as a final very quick comment is that when we give new diagnoses to parents, I think it really helps them if they can just go and talk to someone. And if there is some sort of community that they can build, and that's all been built around certain diseases, certain organizations. Sometimes it's the Canadian Rare Disease Network because there isn't a specific one. But even if you take apart a little bit, even if you've already just fed back to those organizations or somehow participated with them, I think that makes a huge difference to the person coming next. And the worst thing is when we say we don't have anything for you, right? We don't have anywhere for you to go. And because there may only be a few other people in the world with that. And that's always the worst conversation. But I think what's been built by Ian, Genevieve, others in the room, like really, really helps the next set of people being given that diagnosis.
We want to hand over a comment to the crowd, and fair to have a mic so that everyone online can hear. Oh, yeah,
Is this
just
thing on?
flick it up. The button on the side.
Okay. Wake up, everyone. Just as we're wrapping up, thanks for the panel, and Jordan will close the panel in a second, but I introduced Teddy very rapidly at the beginning, and I see Dr. Jerome coming back. Teddy is the project manager for a program for many years called Healthy Child Uganda. Also ran a large project called Healthy Adult and Young Adult, right? Adolescent and young adults in Uganda. And has a lot of experience with families. So I just thought maybe it'd be good to have some comments from Teddy.
Thank you so much, and thanks for inviting us. We are, myself and Professor Jerome Kabachenga, we are from Barara University of Science and Technology in Uganda. And we have been running a community engagement program for the last 20 years. But most of our focus was on preventable diseases that were claiming the children and the mothers, especially in terms of maternal, newborn, and child health related complications. But along the way, we have now come to realize that what you're discussing here is what we are going through. There's reduced malaria. Now we had the bed nets that are treated, which reduced the prevalence of malaria. Now they have introduced the vaccine for the same illness. And what we are now seeing is these things you're calling the rare diseases coming up, and really, of course, like in your environment, whereas you're talking about systems and not being ready, but then when you come to our environment, it's a different story. Recently, as we did the scanning, we had two touching stories. One of them is a mother who has had two children with the rare disease. Of course, with the complications of accessing care, even being able to diagnose whatever it is, having the other child left at home, maybe without support, because there is a lot of stigma around these children who behave in a way other children don't behave. As she told us her story, the 10-year-old does not talk, but he's very active. If he's let go out, he will climb, he will go into people's homes, So what she has resorted to is tying her in the house so the boy does not get out, because the community does not understand. They think the child is possessed. So you can see that trauma, that torture that mother is going through. Now she gets another child. The other child has Down syndrome. That is so far their diagnosis, but they are suspecting the child will not even be able to see. She's living in absolute poverty. Then another one who was a little having some social support, the school system was not ready for such a child with autism. So what they resorted to, whereas the other kids go out to play, because for him, he appears to be violent, that is what they describe him to be. So they tie him on a desk. So the mother has now withdrawn that child and taken her back to where she belongs, maybe where the parents understand that situation. So for us being here, we are learning. We have been able to establish communities, especially in our country. We have the strong community health worker program. It's countrywide, but also the being active depends on how you orient them and how you prepare them to get ready to support their communities. So as I sat here, I was looking at, the readiness that we have to be able to tackle such a huge challenge. And in terms of readiness, at least I was seeing that given the packages that we have had, because we have developed a model which we call maximizing engagement for impact and readiness. And we work with the health system. Now we have put on board the health education, the education system as well. Then in this, I see a lot of family support. Apart from the mother and the father, there's need for mobilizing the rest of the families to be able to support the community to understand and be able also to support these families, but also the strong researchers that should work to come up with solutions, like the way we see the engineers, how they're helping these children also to live a life like others. So we are so happy that we have just had renewed collaboration with Currie, and we will be able to strengthen this when it comes to adding it on the program in Uganda. Dr. Francois has been there and has already met some pediatricians and other people from different disciplines who are interested. So my being here and Prof. Jerome, we have been able to learn, and we are now part of this network. Maybe next time we'll come to share what we'll have done. Everyone has a story to tell. Because as I watched the mothers create their stories, I remembered mine. I had a baby at the airport who was 1.1 kilograms. And what I went through, yet for me, maybe I was in a better position, getting a hospital where that baby could be intubated, going through, being away from work for 3 months. You don't understand why you're not at work. You're even about to be terminated from work. Then you get home, the baby is still so small. Everyone thinks maybe you borrowed a baby from abroad. That torture alone. I remember I was not even able to breastfeed the baby because the baby was so small, too tiny. And because you don't even have the right questions to ask, the doctors don't tell you. Now I do understand. They were telling me to do kangaroo mother care, and no one was telling me why I had to do it. At first I thought it because I had feared the baby because of the size. Now I do understand. So there's a lot that we can learn. I know we are late, and maybe next time we'll be part of the conference to share our experience of how far we have gone with initiating some of the programs that can be helpful, and maybe our researchers will be here to share some of the researches they are doing around this. Thank you so much for the opportunity.
You know, you've
Thank you, Dr. Francois, for giving us opportunity to attend this this session. Mine is about the healthcare system being designed to take care for the majority of the health problems and not even putting into consideration of the few who have these rare conditions. And it becomes a bit more severe in our low income or low resource settings. And I think the networks that are developed by parents, and I think would be something that can be used by the researchers to bring out that sort of understanding, changing in policies. Whereas there may be differences in terms of resources, but once you go to analyze deeply, you find it is still the same challenges we have. As we try to have some solutions to these commonly prevalent conditions, then the issues of these rare diseases are now coming up, and our healthcare systems are really not designed for that. They are looking at the majority of, the diseases which affects the majority of the population. Would like to thank all the presenters for sharing their stories, so that we can also come to know that in other environments, there are people trying to find out, find out solutions for these challenges. Thank you.
This man was Dean of Medicine for 11 years and established an Institute of Maternal Child Health. Teddy's been the program manager for, I won't say how many years, Teddy, but the work has been incredible.
So we've locked our first speaker in for next year. And I would like to say thank you to the three of you for wrapping up on the panel discussion. We will graciously dismiss you from the stage before we get to the final comments. Thank you so much. And again, thank you to all of the speakers this evening. An incredible evening of shared knowledge, lived experience, and expertise. So a really fantastic run to the rest of the week. And again, like we spoke at the beginning of the night, beyond. I think it's worth, just giving a quick recognition yet again to our sponsors, our presenting sponsor, the Canadian Institutes of Health Research, and the champion sponsors, Innovative Medicines Canada, Bio Alberta, Genome Canada, and Genome Alberta. Thank you so much for the support as a group of sponsors. To close everything off, I would like to introduce back to the stage Dr. Bernier.
Okay, I'm standing between you and some food and some networking time. So for those of you tracking, there is an announcement of a Liberal government. I don't think it's clear yet whether it's a majority or minority, unless someone else has got an update. But okay, so thank you, Ashley, for starting us off in a good way, in a deeply personal way, and not easy to share, but it's the stories that are important to us. So thank you, Jordan. Thank you for what you do, for what you're going to continue to do. And I hope we have our MC locked up for our next event. That would be amazing. Svenja, Karishma, to the team who organizes all these things, always a tremendous amount of work, and so professionally done. So the Canadian Rare Disease Network is funded by a project called One Child, Every Child. The hopes and aspirations that we would have for a child, could we make those available to all children, but also all families and all communities. And this is a federal government funded program from Canada First Research Excellence Fund. And we're proud to be supporters of the network. I think, it's a good time to be in rare diseases. And I say that because there have been more difficult times in rare diseases. But I refuse to say it's a great time to be in rare diseases because I think it can be better. And really, I think what we're hearing tonight is we're going to be better together. I think we're better because we bring families into our stories. We bring trained individuals who have learned how to perform research, to be engaged in research, how to lead research, how to lead research voices through the PACER programs. I think we have industry. Industry plays a crucial role. They are the funders, they are the innovators. We need to figure out how to work with our industry partners, how to enable their success and our success. So we have industry partners in the room. We have research funders who are the enablers of the research engine. We have care providers. So really, I think in the end, the question is, how do we continue the momentum? Because there is momentum. Never seen this before in my career. Never seen this before in my career. But I don't want this to be the apex. This cannot be the apex. So the challenge is short, medium, long term. Short term, go out in the back, meet people, figure out what you're going to do to support the vision over the next evening tonight, but also in the next 2 days of the CORD meeting. How can you contribute? How can you add? Can you advocate for better patients' outcomes for rare diseases, whatever role you play? So anyways, thank you. There's food and networking at the back. And for those of you at the CORD meeting, hopefully we'll interact over the next few days. If not, our team's around. And thanks to everyone.